Have you ever felt an odd symptom and wondered if it could be something serious, only to ignore it, hoping it goes away? What if that symptom is an early sign your kidneys are in danger? The kidneys are vital organs that filter and remove waste from your blood. When they start to fail, your body sends out warning signals. But many people overlook these signs or mistake them for something less serious. In this video, we're going to reveal 9 warning signs your kidneys may be failing. By the end, you'll know exactly what to watch out for and why you shouldn't ignore these symptoms. Before we dive in, consider this. According to a study published in the American Journal of Kidney Diseases, 1 in 10 adults worldwide have some degree of chronic kidney disease, and many don't even realize it. This shows just how common kidney problems can be, and how easy it is to miss the warning signs. Stick around, because the information you learn today could be life-saving for you or someone you love. Number 1. Fatigue. Fatigue is one of the earliest indicators that something might be off with your kidneys. When kidneys are functioning properly, they help produce a hormone called erythropoietin, EPO, which signals the bone marrow to make red blood cells. If your kidneys aren't working well, your body may not produce enough EPO, leading to fewer red blood cells and, consequently, anemia, which manifests as constant fatigue. Think about a coworker who starts to nod off during short breaks or complains about feeling exhausted despite getting a full night's sleep. They might attribute it to stress or a busy schedule, but fatigue that doesn't improve with rest can be a red flag. Dr. Megan Norwood, a nephrologist based in Boston, emphasizes that fatigue is not just tiredness. It's a state of exhaustion that can affect your ability to function. If you notice this persistent feeling, it's worth investigating further. 2. Muscle cramps. When your kidneys are struggling, they can't properly balance your body's electrolytes such as sodium, potassium, and calcium. This imbalance often leads to muscle cramps, which can be frequent and very painful. You might be awakened in the middle of the night by a sudden intense muscle cramp in your calf. Or you find your legs cramping more often during light exercise or even walking up the stairs. A study in the Nephrology Dialysis Transplantation Journal found that chronic kidney disease, CKD patients often report more frequent muscle cramps, which can severely impact their quality of life. 3. Swelling. Edema, or swelling, particularly in the ankles, feet, and hands, is another big warning sign. The kidneys regulate fluid balance in the body. When they fail, fluid can accumulate in various tissues, leading to swelling in extremities. You might also notice puffiness around the eyes. Imagine noticing that your shoes or rings feel tighter than usual, or you see distinct marks when you remove your socks at the end of the day. This may not just be due to heat or water retention from a salty meal. It could signal kidney issues. Nephrology specialist Dr. Samuel Collins explains, if edema becomes persistent and is paired with other symptoms like fatigue or changes in urination, it's an important clue that kidney function could be impaired. 4. Loss of appetite and eating less. Kidney failure can lead to a buildup of toxins in the body, which can alter your sense of taste and make eating less appealing. As a result, many people with declining kidney function notice they simply eat less or have a low appetite. A family member might start skipping meals or say they just aren't hungry anymore. Over time, this can lead to weight loss and nutritional deficiencies. The National Kidney Foundation notes that reduced appetite is a very common symptom among patients with kidney disease, often contributing to further health complications if not addressed. 5. Itching. Persistent itching or pruritus, especially if there's no obvious cause like a rash or allergy, can be associated with waste products accumulating in the blood. When your kidneys aren't able to remove these toxins effectively, your skin may pay the price. Someone might notice their arms or legs itching constantly, and no amount of lotion or topical cream provides relief. They may scratch until the skin becomes red or even breaks. Dr. Lisa Freeman, a dermatologist, notes, "Chronic itching is often overlooked as a minor annoyance, but when it becomes persistent and severe, it's critical to investigate potential internal causes like kidney dysfunction." 6. Shortness of breath. Shortness of breath can occur for two main reasons when kidneys start to fail. Fluid buildup in the lungs. Improper kidney function can lead to excess fluid retention, some of which accumulates in the lungs, making it harder to breathe. Anemia. As mentioned earlier, reduced EPO leads to fewer red blood cells. With less oxygen circulating in your body, you may experience shortness of breath even during mild activities. You notice you're winded after climbing just one flight of stairs or after a short walk, something you used to do easily. According to a clinical review in Kidney International, approximately 1/3 of patients with moderate to severe CKD report shortness of breath as a common symptom, highlighting the role of fluid balance and anemia in respiratory issues. 7. Memory loss, confusion, dementia. It might surprise you, but kidney issues can affect your brain function. The buildup of toxins can lead to cognitive problems such as confusion, difficulty focusing, and even memory loss or symptoms similar to dementia. An older adult might start forgetting simple daily tasks or appear disoriented more frequently. Their family might assume it's just normal aging, but if these issues develop rapidly or coincide with other kidney-related symptoms, it's worth investigating kidney function. Neurologist Dr. Raymond Lee mentions, "We're seeing more evidence that poor kidney function can impact overall brain health due to the increased toxic load in the bloodstream, contributing to confusion and memory lapses." 8. Urine-like breath or abnormal taste. When the kidneys fail, the body has trouble filtering out urea, causing a breath that smells like urine or an overall metallic or ammonia-like taste in the mouth. This condition is sometimes referred to as uremic fetor. A friend might complain that everything tastes off, like metal, or that they have a strange aftertaste no matter what they eat. Or you notice someone's breath has a distinctly pungent smell, almost like ammonia. A paper in the Clinical Journal of the American Society of Nephrology points out that a significant portion of CKD patients report taste changes or a foul breath odor that correlates with higher blood urea nitrogen levels. 9. Skin changes, discoloration, and dryness. In addition to itching, kidney failure can cause noticeable skin changes. This could include a grayish or yellowish tinge to the skin, unusually dry or flaky skin, a buildup of crystals that can appear like a powdery film on the skin, known as uremic frost in severe cases. Perhaps you notice a loved one's complexion looking sallow or gray, and moisturizer doesn't seem to help their persistently dry, flaky skin. Dermatologists often coordinate with nephrologists when these types of skin manifestations appear without another clear cause. According to Dr. Jonathan Hale, if we see a patient with sudden and unexplained skin discoloration or dryness, we sometimes recommend tests to rule out underlying kidney dysfunction. If you or someone you know is experiencing any of these 9 signs, especially in combination, it's crucial not to ignore them. Kidney disease often creeps up silently, and the symptoms can be vague. That's why early detection and intervention can make all the difference. Consult a healthcare professional if you're worried about any of these symptoms. Simple tests such as a urine test, blood test for creatinine levels, and imaging can give you and your doctor a clear picture of your kidney health. Don't forget to like, share, and subscribe if you found this information valuable. You never know who in your circle might be experiencing these symptoms, but has no idea they're related to kidney health. Thank you for watching, and see you in the next video. Stay informed and take care of your health.